Have you ever wondered if everything doctors say is true? What if I told you that many of the recommendations we hear daily are based on myths or even lies that modern medicine has perpetuated for years? Yes, you may be being deceived, and worse, by those you trust most to take care of your health. Excessive medications, wrong advice on nutrition, and even treatments that don't make sense. All of this is part of a system that is often more interested in selling quick solutions than in actually healing. If you think you've heard everything about health, get ready, because you're going to expose 9 of the biggest lies doctors tell, and you're going to show the truth that few want to reveal. And if you're thinking this is going to cause controversy, you're absolutely right. Modern medicine, as we know it today, is extremely efficient in treating symptoms, but does it go beyond that? Many doctors immediately resort to medication, ignoring the fact that the human body is a much more complex machine than we imagine. While some believe that pills are the only answer, others argue that food can have the same healing power. And therein lies the big question: why not explore more of what nature offers? Think about how proper nutrition can transform someone's health. For example, a person with high cholesterol could replace medication use with a diet rich in avocado, fish, and whole grain foods. This not only avoids possible side effects of medications, but also promotes healing from the inside out. Traditional medicine is starting to look at these approaches more carefully, but there is still a long way to go. This more holistic approach to health has gained traction, but has faced resistance, in part because many doctors have not been trained to see nutrition as part of treatment. And this is where medical education comes in, a field that still needs to evolve a lot to integrate these ideas. After all, if from the beginning of medical training nutrition was treated as important for life, imagine the impact this would have on the way health is practiced around the world. From the outside, a doctor's training appears complete, but there is a crucial gap that goes unnoticed: nutrition. During years of studies, most of the time is dedicated to learning about diseases and pharmacological treatments, but only a minimal fraction is focused on the impact of food on health. This results in doctors who are extremely competent at prescribing medications, but often unprepared to talk about food as a healing tool. Imagine if, instead of a brief mention of nutrition, doctors went through entire courses on how foods can prevent and treat disease. A patient with diabetes, for example, could leave the office with a detailed meal plan, in addition to a prescription for medication. Doctors like Dr. Mark Hyman already follow this line, recommending dietary changes that help reverse chronic diseases. But unfortunately, this is not the norm in today's medical education. If universities focused on training doctors with a more holistic view, who considered both medicine and food as medicine, the healthcare system would be very different. But for this to happen, a structural change in medical education is necessary. And this change begins with recognizing that the human body responds in surprising ways to the way we eat. This leads us to wonder, what else could be uncovered if old medical myths were revisited? Even with all the modern science at our fingertips, there's still many lies that doctors perpetuate. Not out of malice, of course, but because of being stuck with outdated ideas or outdated data. A classic example is the myth about the gallbladder. Many believe that removing a gallbladder does not cause any major problems, when in reality, this organ plays a vital role in the digestion of fats. Removal can lead to long-term discomfort, something that was mentioned previously. Another popular myth involves statins, which are widely prescribed to control cholesterol. These medications are effective, but are they always necessary? For many patients, simple dietary changes, such as increasing fiber consumption and foods rich in good fats, could significantly reduce cholesterol levels without the need for pharmacological intervention. Imagine avoiding a lifetime of medications just by adjusting your diet. It is possible and within everyone's reach. There's also the old salt myth. For years, we've heard that we should reduce sound consumption as much as possible, but the reality is more complex. The problem is not just the amount of salt, but there is no balance between sodium and potassium in the body. This balance is the real secret to controlling blood pressure. This makes us question, how many other myths are still out there, waiting to be uncovered? Red meat is one of the most controversial foods these days. On the one hand, we have those who claim that it is the main culprit for heart problems and high cholesterol. On the other, advocates of grass-fed red meat who consider it a rich source of essential nutrients. The truth is that not all red meat is the same. Paste-raised beef has high levels of omega-3 and B vitamins, in addition to being less processed. Now consider someone who replaces processed, additive-rich meats with quality red meat, like grass-fed steaks. This simple adjustment can bring major health benefits, from increased energy to better muscle function. Contrary to popular belief, red meat can be part of a healthy diet if consumed in moderation and paying attention to its origin. What we should avoid are processed meats, full of preservatives that affect health in the long term. But what really matters here is an idea to question yourself. Don't blindly accept what is considered right or wrong when it comes to food. Red meat, like other natural foods, has been unfairly demonized. And in reconsidering these myths, we ask ourselves, do other popular concepts about health also need to be revised, such as the issue of salt and potassium? Did you like this production, or would you like to adjust something? For years, we've heard that salt is the main culprit behind high blood pressure and heart problems. But in reality, the secret to good cardiovascular health may not lie in balancing salt and potassium. Audio has an important role in the body, but when taken in excess and without adequate deposit compensation, it can indeed cause damage. What many don't know is that foods like bananas, avocados, and special foods are rich in potassium and can help balance this game. Imagine someone who, instead of just cutting salt from their diet, starts consuming foods rich in potassium daily. This simple change can have a profound impact on your health. Blood pressure stabilizes, the body retains less fluid, and the risk of cardiovascular disease decreases. This is not about demonizing salt, but about seeking an intelligent balance, something that many doctors do not usually mention in their guidelines. This balance not only affects blood pressure, but also several other body functions, such as muscle contraction and nerve function. By offsetting salt intake and focusing on adequate potassium intake, many people could become free from blood pressure medications. And of course, this raises an important question. Does this same logic apply to other areas of supplementation, such as vitamin D? Did you like this production, or would you like to adjust something? Vitamin D is one of the big stars when we talk about bone health and immunity, but interestingly, its dosage remains a point of debate. Many doctors still recommend minimal doses, which may be insufficient for most people. Sun exposure and adequate supplementation are fundamental, but what we often see are conservative guidelines that do not meet the body's real needs. It's as if we are underutilizing a powerful tool for preventing disease. Think of someone who lives in a city with little sunlight during the winter. For this person, relying solely on vitamin D absorbed through the skin may be insufficient. By increasing supplementation, the health effects can be remarkable, from improving mood to strengthening the immune system. Recent studies show that adequate levels of vitamin D can even help prevent chronic diseases such as diabetes and cardiovascular disease. It's much more than just a vitamin for your bones. Therefore, it is time to start looking at vitamin D in a different way, with higher and more personalized doses for each individual. What is considered enough can vary greatly from person to person, and this personalization in healthcare is essential. When we make room to offset doses of nutrients like vitamin D, we're moving closer to a more complete and thoughtful view of what it really means to take care of your body. After all, what other concepts about health could be similarly reevaluated? Now that you know the lies that modern medicine has been telling, the question that remains is, what are you going to do with this information? Will you continue to accept everything they say without questioning, or will you start making decisions about your health? The truth is that change is in your hands, and the first step is simple. Start applying what you learned here today. Have you ever thought about how small changes to your diet and habits can save you from unnecessary medications and improve your quality of life? The decision is yours. Continue on autopilot or take control of your health and live with more freedom and well-being. And if you want more tips to truly transform your health, be sure to subscribe to the channel and turn on notifications. With each new video, you'll be one step closer to mastering your own health. So what are you waiting for?